Good afternoon. Thank you for tuning in to the Government of Newfoundland and Labrador's COVID News Conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honorable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
have to quarantine for a full 14 days, but will be required to self-isolate until the test results are back. There has been one new recovery since yesterday, leaving 20 active cases in the province, and the total number of cases in our province to date is 355. And in total, we have tested 66,084 people. We now have a total of 3 cases in Harbour Breton, and Public Health is still investigating and conducting extensive testing to identify the source. While the investigation will continue, the fact is that we may never uncover the origins of this cluster. So a significant part of our focus as well is to identify and contain any cases of COVID in the community. To help us do this, we are now asking everyone in the community of Harbour Breton to get a COVID-19 test, even those who have not been outside the province or don't have symptoms. Please contact 811 to book an appointment for testing. We have started rapid testing on site for those who have had symptoms less than 7 days, which we hope will increase the speed at which we can detect symptomatic cases. I thank everyone who has taken to social media to show their support for the people of Harbour Breton. For communities staring in the face of COVID, this is exactly what they need. They need to know we are all in this together and that their fellow Newfoundlanders and Labradorians are behind them 100%. It is your support that will give people the courage to get a COVID test, with the reassurance that they will not become targets for bullying and discrimination. So we need people to feel safe to come forward for testing so we can find and contain the virus. This benefits everyone. This is the 3rd rural community in our province to see a COVID cluster in recent weeks. For the residents in Grand Bank, Deer Lake, and now Harbour Breton, this is a very stressful and concerning time. And it is a stark reminder that COVID can be anywhere, anytime. We have seen tremendous cooperation in each of these communities, and I thank them for their support. As I've previously indicated, province-wide shutdowns on the scale we saw in the spring are a last resort. Moving the provincial alert level is an action we would only take if we saw wider spread of the virus in the province. Our goal is community or regional restrictions to contain any isolated clusters that arise. We want to ensure that communities and regional health authorities are supported in their decision making. Our public health team is refining guidance for communities that align with epidemiology and best available evidence so that they have assurance that they are taking appropriate action. As a recap, for those who may have just joined us, we have 1 new case since yesterday's media advisory, and the total number of cases in the province is 355. As I have said before, the reason we have fared so well to date is directly attributable to our strict adherence to the public health measures in place. If not for our strong collective actions, this virus would have progressed much differently in our province. Do not let complacency set in now. Please keep Harbour Breton front and center in your mind, and remember how you can protect yourself, your family, and your community with our layers of protection. Keep your close, consistent contacts to 20 or less. Stay home if you are unwell, even if your symptoms are mild. Avoid gatherings outside your close, consistent contacts, and avoid crowded stores. Wash your hands often and well. Wear your mask when in indoor public spaces, and stay 6 feet apart from others who are not your close contact. Before I close today, I would like to wish a happy Hanukkah to those celebrating. I wish you a safe and joyful week as you enjoy the festivities with your families. Thank you, Newfoundland and Labrador, and hold fast.
Thank you very much, Dr. Fitzgerald. It is day 279. Happy Hanukkah to my Jewish friend, and again, I echo Dr. Fitzgerald's sentiments. We have 20 active cases, so we're hovering around that number. Obviously, the efforts everyone is making are paying dividends in helping contain this virus. Dr. Fitzgerald referenced in Harbour Breton that the criteria for testing have been broadened. The rapid PCR equipment is down there, is functioning, and results there will take about half an hour. There is a process in place whereby these results for validation purposes are currently being double-checked by being sent out subsequently to the public health lab in St. John's. And those of you who remember back to the winter will know that in the early stages with our PCR testing in the public health lab, we did exactly the same kind of validation, only we used Winnipeg and the National Microbiological Laboratory. The ID now has been in the province a while, and we've been able to get the equipment up, running, and validated. In terms of the other rapid testing equipment, the antigen-based one, that was later arriving, and the laboratory staff in Eastern Health around public health are currently working through the process of getting that ready, should that turn out to be needed in a similar, more inaccessible or isolated community. So we look forward to seeing how the results perform and how we can use this technology should we have further outbreaks in more rural or isolated areas, and maybe this would be very suitable for those settings. In terms of results, you may remember I referenced earlier on in the week that we would change slightly the way the reports were delivered. We have an approach here to divide the province into zones. The reason for that is around preserving the degree of confidentiality and yet making the results more geographically relevant to people within this province. This change to the hub, along with a table that denotes potential source of the infection, as, for example, under investigation or from travel, these kind of things, that will start up on Monday, and those who are interested will be able to access that page from our COVID-19 website. The final piece of news, I suppose, would be the issue around vaccine. As I said earlier, a dummy shipment to test the ability of our thermal shipper to keep things cold was successful, and I'm currently informed that actual dosage trays of the vaccine will arrive in the province early next week, and within no longer than 48 hours, the public health staff will begin a program of vaccination. The Public Health Agency of Canada and Pfizer have insisted that at least the first two sets of deliveries be done from the depot that they arrive at. So hence, for those a couple of thousand individuals, that will have to be done in relation to the depot in St. John's. Hopefully thereafter, having tested and demonstrated that element works, that will then allow the distribution on a more on a wider basis. So we look forward to that. There's still no definite date yet for when the Moderna vaccine will either be approved or distributed. That will certainly make life easier for public health, particularly when getting into rural or more isolated communities, which are a source of priority and concern for us under our guidelines that we've agreed with the national umbrella. So really with that, I echo Dr. Fitzgerald's comments about holding the line and bearing in mind good public health advice about keeping your distance and wearing your mask and being responsible about who you mix with, for how long, and under what circumstances. So with that, Leslie, I'll call a halt and turn it over to you for the rest of the question and answer period.
Thank you, Minister. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, the case that we saw yesterday in Harbour Breton, can you give us a little more information about that? Is that also tied to the hospital like we've seen with the other cases? And is this someone who had close contact with either of the 2 cases, or is this someone who has also picked it up from an unknown source?
So the investigation into the source is still continuing, so I can't really give any further detail on that at this point. that person was a healthcare worker, but I can't give any further information due to privacy issues or reasons.
And so what has the impact then been on the health facility to have someone else who's testing positive? Does this mean that you're now having to test even more people there? Are more people going into isolation? Perhaps, Minister Haggie, you could address that.
Certainly. Thank you very much, Peter. From the point of view of the operations of the health centre, visiting was restricted pretty well immediately upon the discovery of the first case. The long-term care section has been physically separate from the acute care and there's kind of doors and things like that allow a barrier. So they are now being staffed separately. So as in the early spring, late winter, there is no overlap of staff to protect the residents. Central Health are identifying a couple of visitors for each resident, and they have been offered testing. And once those individuals are tested negative, they will be the designated visitors until these restrictions can be eased. I am advised that it is still possible to undertake clinics, and certainly the emergency department in Harbour Breton is still functioning. So we've endeavoured to adapt to the impact of COVID-19, but we've also, I think, seen a maintenance of important service levels there as well.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello, Dr. Fitzgerald. Given the uncertainty of source in Harbour Breton and the fact that you're now wanting everyone to get tested there, do you feel schools should still be open?
So at this point, we've no evidence that there's any transmission happening within schools. So we do have, criteria for when we would close cohorts within a school, and then closing a school itself, even if there was a person who tested positive within that school, is not necessarily something that we would do. Obviously, it takes there has to be some judgment there on the part of the regional public health staff and the medical officer of health to determine, there may be other issues at play that might weigh in on that decision. But for the most part, we are looking for a source. To date, we found one more case. That's it. We haven't seen anything within schools. So at this point, we don't have any evidence to suggest that we need to close schools.
Okay. And I guess this is a question for the minister. The federal guidelines are such that the Indigenous populations have to be vaccinated, that there's a proportion of the vaccine set aside for that. How are you going about determining the urban Indigenous population for your first batch of vaccination?
That's a very good question. Certainly Indigenous communities have been identified. I think the challenge is around the distribution of the Pfizer vaccine, which once out of an ultra-low freezer has a very limited life. Our vaccination team have in mind a way of delivering that vaccine to rural and isolated communities, such as in Nunatsiavut, who actually have their own public health nurses, and also to Innu Nation. There will be discussions with Con River, for example, about the band and the reserve down there. So those plans are currently maturing. I will be having a meeting with Indigenous leadership and Minister Dempster early next week to discuss those still further. From an operational point of view, certainly the arrival of the Moderna vaccine would be a huge asset in being able to distribute to such communities in coastal Labrador, for example, because it is far easier to ship.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. The federal government is beginning a compensation program for anybody who has serious side effects of the vaccine. There are already fears about this vaccine. How concerned should people be with this extra layer of compensation?
From the point of view of vaccine safety, I think Dr. Fitzgerald would be eminently able to testify to that. I think the idea of a no-fault compensation scheme is something actually that's really very old. And it came out of the Creever inquiry, if I'm not much mistaken, some 2-3 decades ago. So again, I think that is an extra layer of reassurance. But certainly, in terms of the safety of the vaccine, I think that would be regarded very much as a course of last resort. I don't know if Dr. Fitzgerald has any comments from a public health or clinical point of view.
Certainly from a safety point of view, we look at, as I've talked about previously, this vaccine has gone through the same rigorous safety protocols that any vaccine would go through, and if Health Canada has approved it and deemed it to be safe and effective.
Thank you. And with the vaccine to begin to be distributed in the province next week, is there a priority list set yet on who will be receiving those first doses?
So there are restrictions on exactly what we are able to do with that vaccine. So, the manufacturer has had some requirements for us. So it has to be kept in an area that, has the ultra-low freezer. It cannot be distributed past that. So it has to be administered at the point that it's coming to the province. So for that reason, won't be able to be administered out to, say, long-term care facilities, that sort of thing. So we will have to be looking at other people in our priority, in that first groups, those first priority groups, which would include those healthcare workers who are at the front lines of COVID care and in direct response to COVID, are working in, directly in the COVID response. Sorry.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. In terms of this new case that was announced today, how were the children that you said might get tested, how were they exposed in this new case? Like, is this a teacher, a daycare worker? How were they exposed?
So it was a staff member of school. So now, given that information, are we considering closing down the school or switching to an online model, a virtual model? Not at this time. We are looking at all ramifications of that. As we said, it's been more than 14 days, so we're outside of that infectious period and outside of that quarantine period. So we're sort of looking at things a little more closely. This is a little bit different than your typical situation that you would have to deal with. Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
In Harbour Breton, Dr. Fitzgerald, it would seem that the cases there would meet the definition of community spread. I've noticed that you haven't been using that term. Why is that?
Well, we don't have our investigation completed at this time. So, public health is still tracking down some leads. We're still testing people. We want to find out exactly what's going on in that community and looking at see if we find other cases, looking at the way this disease may have spread. So once we feel like we have exhausted all those leads and all those possibilities, then we will have to make a decision on that.
Changing topics slightly to look forward to the holidays, anyone who is coming to this province and wants to be out of isolation for Christmas has already been here. I'm wondering if you can give me an idea of how many exemptions you approved for the holiday season, how that compares to the normal sort of volume that you're dealing with, and with the electronic tracking that we now have, how many people either a day or a week are coming into the province?
I'm really glad you asked those questions, Peter. I just happen to have some numbers handy. So for December the 16th to the 31st period, digital applications for all travellers total 1,225. Of those, there are 326 who've received exemptions. The others would presumably be residents and or workers on the Labrador, Quebec border who would apply for access. The first 10 days of December saw us an average of just over 1,520 entries, and that would include the Labrador borders, which by and large account for well over half and often 2/3 of any daily total.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, I just wanted to ask a quick follow to my question about Indigenous population. I was actually curious about the urban Indigenous population. Are attempts being made to identify who would be in the metro region?
Yes, certainly. That's a good question, Peter, and I'm sorry I omitted that group. We're working with the bands and their elected representatives, and the two of it, for example, Con River, to identify their members, and that will be part of our discussions, both directly through the regional health authorities, but also probably more properly through Minister Dempster and Indigenous Affairs and Reconciliation. So that's part of the substance of our discussion next week. But the vaccine committee that we have struck is working on that as well from an operational perspective.
Okay, great, thank you. The question I have is that the English School Board now has set up a possible contingency for school not going ahead in January should things get out of hand, I guess. I'm wondering whether the government, Department of Education, or any other group has worked on any strategies to handle that situation in terms of virtual learning and that sort of thing.
That's a really good question, Peter, but certainly from my perspective, I wouldn't feel qualified to have insight into the NLESD or the school board's operational plans. They, by and large, would have total control over that. Our role in our liaison with the schools and the school board is to provide, through Dr. Fitzgerald's expertise, advice on public health views of what their plans might look like.
Okay, thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. We've heard that there's been issues with the COVID-19 alert app, some people not being alerted if they've been exposed in a timely manner. How do you know if the app you've downloaded is working?
That's a very good question. In actual fact, I've received notification, I think, late yesterday from the Federal Minister of Health and the Minister responsible for the development of the app. There is a new version, so I would go to Google Play or Apple and make sure you have the latest version downloaded.
Thank you. And with the vaccine, again, being distributed next week, what can people expect when they receive that first dose? What are the mild side effects that, come with any vaccine? What can we expect from this one?
So I think, as you said, what happens with any vaccine, sometimes you can get a little bit of a local reaction around the vaccination site. It can get a little bit red. It may swell a little bit. You may get a little bit of pain in your arm where the injection went in. But generally speaking, those are quite mild. They're short-lived. They go away fairly quickly on their own. And then especially you may see fever, and there are reports that perhaps fever is seen a little more with this vaccine than in some other ones, but that may be a potential side effect of this vaccine. But all of these things generally mean that your immune system is kicking in and doing what it's supposed to do. So they're not generally considered severe or really overly concerning.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Going back to the case that was announced today, undoubtedly this will spark some concern from parents in the area. What should they be doing now, and how do you allay their fears?
Well, certainly, if public health has identified that a child needs to have a test done, then certainly we would encourage parents to go get that testing done. As we've been saying from the beginning, make sure if your children are sick, they stay home. Practice all those public health measures, physical distancing, wearing your mask in indoor spaces. You make sure you wash your hands frequently and well. All those things which help to protect and are your biggest source of protection really against this virus. And public health is doing the investigation. If parents need to be, if there are students or staff at schools that are identified as having been close contacts of a case or needing testing, public health will be reaching out directly to do that. So if you haven't been contacted by public health, then you haven't been identified as a close contact.
Thank you. And going back to Harbour Breton for a minute, what public health is pushing for everyone in Harbour Breton to get tested. I was just curious about what have you seen so far in terms of numbers of people coming forward to get tested thus far?
I think there are actually quite a number of people who have come forward for testing. Last I heard was over 500, so that's excellent. I'm really happy to hear that. Like I said, the only way we can get a handle on COVID is to find it. So we want to find any cases that may be there. So hopefully people will continue to come out. We've got the rapid test there now for anyone who has symptoms within the last 7 days or the 7 days prior to having the test done. So that will certainly help with a speedier turnaround time.
Thank you.
I will now go back through each reporter to see if you have any final questions. Peter Cowan with CBC. Do you have any final questions?
I do have a couple of hopefully quick ones. What school is involved in this most recent case?
I don't have that information, Peter, sorry. As I said, that was evolving as I was walking out here, so sorry.
And as we're sort of nearing the end of the year and sort of looking back, a question for both Dr. Fitzgerald and Minister Haggie. You two have sort of become the face of this pandemic for thousands of people in this province. I guess, what have you learned, and what do you think that these now thrice weekly updates have given people?
I'll defer to you.
Up to you, Janice.
I hope that these updates have certainly given people the information that they need to help them to make good decisions, and that we've helped provide enough information that people aren't panicking, that we have tried to encourage kindness and respect, and and I think the public has responded to that, so I'm very grateful to the public for doing that. And I think we've learned a lot. We continue to learn a lot about this virus. I think everybody in the public health sector has learned a lot about themselves and about their resiliency, and I think that's all very good stuff to know. So I think there'll be many books written about this by the time it's all over.
Mr. Haggie?
Oh, sorry. You were on mute. I apologize, Peter. I think that the accessibility and the ability for the media to ask these questions, even if you like during the quiet spell over the summer, has helped keep people informed. Our biggest tool in dealing with COVID is education. And I think because of the fact that a lot of what we thought we knew about the virus has actually changed and continues to change, that regular contact, I think, has been very important. And I think that in contrast to some other jurisdictions who've gone down to weekly or just media releases on paper, we have not seen some of the communications issues, particularly that have arisen in other jurisdictions. One of the things that struck me is that the information that we give at 2 o'clock or 2:30 on the appointed day can actually be out of date by the time we walk back to the department. And that has been a challenge over varying periods during the pandemic. And I think will quite frankly be a problem and a challenge right up until the time the vaccine is really out there and well adopted and in people's arms. And all being well towards the back end of next year, we will be able to part company at 2 o'clock during the week.
Thank you.
Peter Jackson with the Telegram. Do you have any final questions?
I did have one. Earlier this week, the world marveled at the very first vaccinations in the UK. I know in the Nova Scotia Department of Health is taking lists of media in the same regard. Why has the Department of Health decided that that is not going to be something they will treat local viewers to?
Sorry, Janice, I think you have a view on this. I'm quite happy to chip in after you.
I actually missed the question, Peter. I didn't hear it. I'm sorry.
There's not going to be any opportunity for photo or video with the first vaccination is given here. I'm just wondering why that decision was made.
I don't know that the decision even came up for discussion, to be honest with you. But Minister, if you have any insight into that, I'd welcome it.
I think there was a feeling that, quite frankly, there is an element of confidentiality around this. Our important stress from the point of view of public health is that people get vaccinated. We had 480,000 flu shots. Yes, it's new, but really and honestly, the technique of vaccination goes back to the times of Dr. Clinch. So I'm not sure that a photo op will necessarily enhance the safety of the public or improve public health.
Okay, thank you. That's it for me. Thanks.
Thanks, Peter. Kellyanne Roberts with NTV. Do you have any final questions?
I do. I have two. One being that the Prime Minister today has said that it will probably be 6 months till a majority of Canadians are vaccinated. Do you think this is a realistic timeline to apply to Newfoundland and Labrador?
I think from our point of view, some of that's predicated on how the flow of vaccine comes. Assuming we get trays and doses on a regular basis, I don't see that we will have any significant delays in doing this. I think it will be one of those things where it would be nice if it was done sooner, but really and honestly, I'm not sure how realistic that timeline is. It's a good target. It's like our 85%. It's maybe a bit aspirational, but it's something to aim for sure.
In regards to the virus itself, it's great there's a vaccine and then people may be willing or not willing to get it. But I think we might need a reminder that the vaccine will still be here after a vaccination. How will we see a treatment plan or a response to, I guess, these cases popping up after the vaccine begins to be distributed?
So we'll approach COVID like we do any communicable disease. We have processes in place where we deal with that. We would, I think for the foreseeable future, we would expect that any positive cases would have to self-isolate and their contacts would have to quarantine as we do now. Because we don't have a lot of information about the vaccine and how long the vaccine lasts and how it might affect the ability to spread the virus and that sort of thing. So those are all questions that will come along as time goes on and as we have more experience with that vaccine. But those plans will still be there. We'll still, because we do expect to see cases of COVID, absolutely. And those processes will be in place even after the vaccine, just as we have for measles right now. So, we have a way to deal with any positive cases of measles, and so we'll develop those plans for COVID.
Thank you.
Richard Duggan with VOCM. Do you have any final questions?
Yes, I have two. We've heard of businesses earlier today sending out supplies of masks to Harbour Breton to make sure that they're stocked well enough with PPE, given the situation there. Does Harbour Breton have sufficient PPE right now?
As far as I'm aware, the answer is yes, and there is a depot in Central Health which can supply more should that become necessary. That's an operational issue, but we are pretty well stocked for PPE. Our aim provincially was to have 180 days at pandemic burn rate. We are probably, we're certainly over 50% there. The last figures I saw, which are a little bit older, would suggest we may be 2/3 of the way there. But we don't have any indication that PPE is in short supply in Harbour Breton, or indeed anywhere else.
Thank you. And we know that you have repeated the message numerous times over the last few weeks about 20 for 2020, but we're still getting questions from people who say further clarification is needed, and we're hearing from people who are planning multiple get-togethers with up to 20 people each. So I guess it bears repeating. What are the do's and don'ts for 20 for 2020?
So what 20 for 2020 means is that you have 20 close, consistent contacts at most. Doesn't have to be 20. You can have less than that. That might even be better. But you can have up to, or we're recommending up to 20 close, consistent contacts that you interact with over the holiday season. We know that the holiday season is very much a time of get-togethers and parties and gatherings with friends. Sometimes that can be work parties, it could be social, your social circle parties, and very often people can interact with hundreds of people over the holiday season. So what we're saying now is that if you're going to be having gatherings, if you're going to be spending time with people, that it's the same 20 people that you're seeing over that period of time, so that you know who your contacts are. If somebody gets sick, if somebody develops COVID, you can easily identify who those close contacts would be, and we can do, public health can do contact tracing effectively and efficiently. The more people that you have, the more contacts that you have, the harder it is to do that. So we're just asking people to try to keep to a very close, consistent 20 over that holiday period. Our gathering limits are up to 20 for informal gatherings. So that could be, some dinner in your house or a party, a get-together in your house. But that would be the maximum number of people that you would be allowed at any one event. But obviously, if your house can't accommodate 20 people, then you shouldn't have 20 people in your house without the appropriate physical distancing. So it's really just about keeping your contacts low and consistent so that you can identify them should we have a situation where, we have a case, similar to Harbour Breton, where we may not know where that's come from. You can tell us who your contacts are so that we can reach those people quickly and efficiently.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thank you very much, Leslie. I'd like to thank everyone for their interest. I'd like to wish everyone a happy weekend and a bit of a break. I think it's also worthwhile pointing out to the media that the timing around Monday's event may have to be changed, given the fact that the Speaker is reconvening the House at 1:30, and we will do our best to advise you promptly and as early as we can about that. So again, have a good weekend, and thank you.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.